Hour of the show, The Morning Crossfire, and it's divided into two. The first part, we'll be talking with the NCDC on the present situation of COVID handling in Nigeria generally, not just in Lagos alone, in Nigeria generally. And the second part, we'll be delving into the hike in electricity tariff. So let's get on with the conversation. Yesterday, the NCDC announced that about 1,354 new cases were confirmed yesterday alone. As it stands today, we have total confirmed cases at 92,705. Discharged as at yesterday night, 76,396. And we've lost, sadly, 1,319 Nigerians. Cases. Well, even that yesterday, breaking it down further, Lagos recorded 712 that yesterday. Abuja recorded 145, Plateau 117, Kwara recorded 81, Kaduna 54, Sokoto 39, Rivers 37, and it goes on and on and on. Kano recorded 3 cases yesterday. One of the major questions on the lips of everyone is, why are the numbers still meager? Why are the numbers still low? We have joining us right now on the show someone who is no stranger to the Morning Crossfire. He was here last year to discuss the same issue, that we spoke about on the program last year. He's joining us again this morning via Skype. In case you're not watching online, you can please go to Facebook and YouTube to go see my guest live. It's Dr. John Oladejo, the Director of Health Emergency NCDC. Dr. Oladejo, a very lovely morning to you, sir.
Thank you very much.
It's good to have you finally. Now, we're just going to jump right into it because of time. If I may ask, why aren't we testing enough, Dr. Oladejo?
Thank you very much. This has to do with the populate, because the federal government has provided all the necessary infrastructure from the local government level to the federal level. But we still find out that people are not still believing that this COVID-19 is real, or they are still saying that it's still a scam. I'm still very much surprised that people don't still believe that this COVID-19 is real. The point was that initially when we started, we have only 5 molecular laboratories all across the country. But as we speak to you, we have more than 80 molecular laboratories. You can go to any state, any laboratory, and do your test.
Did you say 18 or 80, Dr. Oladejo?
80.
80.
I said from 5. We had 5 initially when we started.
Right.
In February, up to 80 as I speak to you now.
Okay.
So we have it all over the 60 political zone. But the problem we still have is that people are not convinced to go and get tested. You have people that have this symptom of fever, symptom of cough, and all the COVID symptoms. But they still don't go out. Just have the fact that on TV, like your radio, like we are even using what we call voluntary at community as voluntary
awareness. Yeah.
Yes, but people, you go to all these local communities. I'm just coming from my village, and I saw what was happening. It was as if I'm the only one that has had COVID. Because when they see me, they will say, "Oh, he's a doctor from NCDC, so just leave him alone." So those are the reason. People, those are the fact that there are a lot of awareness everywhere.
Right.
Those are the fact that people are coming down with the disease, but they are still not yet convinced. And that's this why we're having this. If not, we will have had at least 2 million tests by now, which is 1% of the total population. Yeah. And that's what will give us a guide, or whether we are actually leveling up, or we are going down, or we are going up, and we need to decide where to deal with it. But people are not really coming out. That is the reason why we still have this bigger number of tests done.
Dr. Oladejo, it's also being said that part of the reasons, you have said that is one of the reasons. Part of the reasons being said is because of the amount involved in testing. Are people required to pay, and in what circumstance will people have to pay?
Okay. Thank you very much for this particular question. The point is that testing for COVID-19 is free all over the country. It is free. You don't have to pay if you are coming out genuinely for the test. Okay. But if you say you want to travel out, we are saying that don't travel out for now.
Okay.
Because COVID-19 is everywhere. So, but if you think it's very, very important, and attaching so much importance to it, you have to pay for it. And that's the reason why we are bringing in private organization to be part of this COVID-19 test.
Okay.
So, if you think what you are going to have to do is very, very important, then you pay for it, because we cannot continue, to use all our resources on such. Let's use our resources locally, and let's be able to know how many people are tested, how many people are confirmed, and how many people we are actually treating. That's the reason why we have to plan, and that money doesn't go to the federal government.
Okay.
It is the private people that get the money, because they have to pay for the overhead costs and everything.
Right.
Though LCDC give them free materials.
I was going to ask you that. Yeah, I was going to ask you that, Dr. Oladejo.
They have to pay their staff.
So exactly. So if you are giving private labs some things to work with from the Commonwealth, why then shouldn't have a say? Why then shouldn't the federal government have a say? I'm not saying they shouldn't collect money, but why so exorbitant? Because we're hearing that people part with as much as 50,000 naira to 55,000 naira to get this test done.
The point is that don't forget that COVID-19 is involved hazard when you are testing, and these people have to be paid very well. It's not the way people in the public sector are being paid are not the same the way they are being paid in the private sector. And they are the one that provided the machines and everything. We are only giving them only reagents. So they just have to bring it.
Okay.
You can't just be doing a business and then you just at first because you want to be a father of Christmas or you want to help others. So they have to put all those ones into consideration.
Right.
And don't forget that PCF starts with them, not just they didn't fix that money. They start with them.
I'm guessing a call came into Dr. Okay, he's back.
Cost. Yeah. So it's not just something that just came from the blues. So everything is documented, and if people really want to know how they arrive at that amount, they will be able to see that they are not even making so much. They just wanted to help, and that is what is happening.
Okay. Now let's quickly talk about, because we're wrapping off in about 10 minutes or so. Let's quickly talk about vaccines. What can you tell us? We're hearing 100,000 doses of vaccines by the end of January. Dr. Oladejo, Shele Dabai, 100,000 doses. Shele Otikereju, is not too small.
I know you will ask that question because it was mentioned yesterday night. In fact, when I was watching TV news, when I saw it, I said, this my friend is going to ask me. As a matter of fact, you know that we don't have enough vaccine for the whole world.
Okay.
Although we have different candidates, and then we have different countries that are actually producing.
Right.
So we have to go through WHO. You can't just go and buy vaccines that when you get people will start shaking. And maybe you have seen it on the internet. When you give somebody vaccine, the person will be with this. So we don't want all those things. So we have to be very sure of what we are doing. So the first thing is that we are actually bringing in 42 million, which is the 20% of the target population for the country.
Okay.
But before we bring 42 million is a lot of
it's quite a lot, yes.
A lot of money. Before we do that, let's bring just 100,000 naira for the health workers who are at the forefront.
Okay.
So let's see what happens from there. Then 42 million will come in. Then next year, another 30% of the total population will come in again.
Right.
So everybody will still have that vaccine. So 100,000 doses you see is just for us to have it first and get it at the potent level and everything.
Yeah.
And then vaccinate the vulnerable and the health workers. So that's what it's all about.
There are fears, Dr. Ladejo, that this 100,000 was just to protect the elite alone, to get the elites vaccinated. Even the health workers might not get, all of them might not, may end up not getting from these 100,000 doses, the first batch that is coming at the end of the month. Why I'm asking this is there a laid down procedure that you use in administering these vaccines to those that actually need it most?
As a matter of fact, you know that NCDC is for prevention and control of any public health diseases.
Right.
But the sister agency that is involved in vaccine preventable diseases is National Primary Healthcare Development Agency. And you can see it was their executive director that actually spoke about vaccine.
Yes, he did.
We have a consortium of experts on the vaccine development in Nigeria, and it is the National Primary Healthcare Development Agency that is actually coordinating it. We are part of that committee.
Okay.
And for them to have arrived at that, they are looking at the WHO protocol. They are looking at what they have. We are adapting the WHO protocol, and then we are actually developing our own protocol to be able to cover at least the front liner, that is the health workers that are actually directly exposed,
right,
as well as the people that are of 55 years and above. So those are the targets. So that 42 million will take care of all those. Other targets just to bring it in by ending of January. So by February, we have to plan, and that's what we are doing now. So by 42 million is just not what we do within 5 minutes or 5 days. It has to be a long-term plan,
right.
So that each geopolitical zone, you identify the vulnerables, you identify those ones that are elderly, you identify the health workers, and then you now swing into action. So fascinate them. So these are the things we are actually doing.
There's also something that is not...
It will get to your reach very soon.
Okay. There's something that is not really clear. It was mentioned yesterday, but let me ask you, Dr. Ladejo, these vaccines that we're getting, are we getting these vaccines for free or we're paying for them?
Actually, they are not really...
We can't. We're losing you, Dr. Ladejo. We're losing you. We can't hear you. Can you hear me? You are talking though. We can't hear you, Dr. Ladejo. We'll try and call you. Let's initiate that call again on Skype and see if we can get to Dr. Oladejo again so he can respond appropriately to that. And we've got about 6 more minutes to go. Hopefully we'll be able to get him back on the line. Then we can have an answer to that on the show today. Are you with us now?
Yes, I'm
Oh, fantastic.
So like CSM, it was free.
Okay.
I was I have been in the period 2017 when we had a very large outbreak. It was free.
Okay.
The measles was free.
Okay.
So I expect this one to be free. But this is my own personal opinion.
Okay.
The committee has to come up and then the government will approve to say this is the token that they're going to pay. Maybe if you go to the private hospital and you want to get it, because of overhead cost, you have to pay. Because all these sensitive diseases, we can get it at the public health facilities, as well as the private. So if you go to the private, you have to pay because they are doing business. For public facilities,
what can you tell us about what we heard also yesterday, that we've been in talks with China? We're hoping to get vaccines from China. What can you tell us about that?
It is only the national coordinator of PTA that will give us more information on that because he's the one coordinating all the COVID-19 activities in the country.
Okay.
So when you get in touch, you will inform us and then we implement.
One last question before I allow Lagos to ask you a question. One last question. And my question, Dr. Oladejo, goes this way, right? We're hearing of a new strain. What can you tell us about that? In Nigeria here, not the one in South Africa and the UK. Is there a new strain in Nigeria?
Yes, I was in the media appearance where this question was formally asked. The point was that in the UK, we know quite well that we had the strain, and then for a few weeks back, we started hearing this information that we had it. And immediately we had this information, the PTF and NCDC set up the expert of laboratory scientists, and they are as I speak. So I'm still expecting their reports because they have started working on this. So they will give us more details on that, and the Director General of NCDC will present it during the next PTF meeting. So it is something that is being worked on.
Okay.
And will give details to the public as soon as possible.
Right. Now, let's take just a call or two before we let you go this morning. 0700 993 993 993. Dr. John Oladejo is here, Director of Health Emergencies at the Nigeria Center for Disease Control. NCDC is joining us via Skype this morning to answer your question. We've got about 2 or so minutes to get you in and ask him any question. Please, when you're calling in, please go straight to the point, all right? Thank you. Chris is here. Hi, Chris. Good morning to you.
Yeah, good morning.
Good morning to you.
Yes, I want to ask the NCDC man, where are the testing centers in each